watching Let's Chat.
As promised a few moments ago, we're going to talk about sickle cell anemia. And joining us with more on that, it is Dr. Jennifer Keates-Baleeiro. Dr. Baleeiro, good morning.
Good morning.
Is it still proper to call it sickle cell anemia, or is it just sickle cell?
Sickle cell anemia is an appropriate choice. It is an inherited condition of red blood cells. It comes basically from genes from your parents. And so as a disease, anemia, that requires occasional blood transfusions, it is a proper designation for that particular entity.
What exactly is the sickle cell trait, if you will?
Sickle cell trait is when you inherit only one gene from a parent that enables you to have sickled cells. If you will, I'll just take a quick tour.
Sure.
These orange slices, if you will, are sickle cells, and these nice big red blood cells that are normally shaped are actually what help you oxygenate your blood. The sickle cells don't carry oxygen very well, and that's why folks with sickle cell anemia, where both genes are inherited from both parents, have a problem with their blood in terms of oxygenation of their tissues.
Is this something that can be cured or simply managed?
So we do have cures for sickle cell anemia. It involves bone marrow transplant, and there's also the really exciting Crispr gene technology. And there are current trials through Dr. Haider Frangul and TriStar Centennial with regards to Crispr genes. So we have some other options just besides bone marrow transplant.
All right, the Crispr gene technology, I'm not familiar with that whatsoever. Fill us in.
Mm-hmm. So it is taking your own cells and actually having them transformed so that they create what you actually have inside your body when you're inside a mom. So we all produce fetal hemoglobin, and the CRISPR gene technology basically ups the fetal hemoglobin in your blood and transforms you from somebody with sickle cell anemia to somebody with sickle cell trait. And that then enables you to live a normal life.
I understand in Tennessee and Georgia, everyone is tested at birth for sickle cell. Maybe if someone is not in a state that requires sickle cell testing, who should be tested maybe as they get into late childhood or even adulthood?
So the newborn screen, as you mentioned, is available, but we can also test anybody who's of childbearing age. So somebody who's planning a pregnancy can get sickle cell gene testing done, and gentlemen who actually are interested in their sickle cell trait status can get testing done as well. That can be done through your primary care practitioner or through an OBGYN if you're a woman, or you can actually get it done through a hematology clinic.
How prevalent is sickle cell in our area?
1 in 300 children are born with sickle cell anemia. Mm-hmm. Normally they have African American descent, but that's not always true since we're a very blended population at this point. So 1 in 300.
And it seemed like several years ago that number was a bit higher and was predominantly confined to the African American population. But we're learning more and more about that, and that's not always the case.
True. And you can also have blends of hemoglobin SC disease and also something else called thalassemia. And without going into too much detail, those hemoglobinopathies can be figured out by doing some testing.
What's a good thing to do if you find out that you or one of your children has sickle cell? Exercise a good option?
Yes, actually we encourage exercise, hydration. If you do have a sickle cell pain crisis, then we encourage for some opiates to be used, but of course that's not our first go-to. We do Tylenol and Motrin, and if needed, kids come to us and they can receive intravenous fluids and IV pain medicine. But for the most part, 85 to 90% of all of our kids stay outside the hospital, and it's important that they go to school, that they participate in sports, that they keep well hydrated, and that they contact us if their pain crisis is not something that they can manage at home.
All right, Dr. Baleeiro, tell us how we can get in touch with you, either a website or an email address.
Certainly. So the website is through Children's at Erlanger at .org, and you can look us up under the Sickle Cell website. I'm also available at jennifer.keates@erlanger.org.
All right, one more time. That is children's at Erlanger.org. Children's at Erlanger.org. Phone number 778-7289. And Dr. Jennifer Keates-Baleeiro, it has been a pleasure having you here on Let's Chat. We thank you for your time and your contributions to help fight sickle cell anemia.
Thank you very much.
Have a wonderful, wonderful day. A little bit later on, we're going to be talking with our friends from the McCamey Animal Center, fresh back from Gulfport, Mississippi, rescuing dogs and cats in advance of Laura and Marco. And also the Austin Hatcher Foundation coming up.